So for those of you who are here and maybe new to New America, one of the things that we do is we try to translate a lot of policy information for reporters on our blog, Early Ed Watch, but we also produce papers that we hope are providing some guidance to policymakers on smart ways to approach new issues, on ways to get through gridlock on various problems that might be happening at the state level or the federal level in terms of policy. And I'm really proud to introduce to you our policy analyst, Laura Bornfriend, who has done some incredible work on the policies around teacher preparation, which clearly are a big issue. It was great to see the questions that came out of that last panel on this. And actually, if I could ask, feel free to kind of move up. Those of you who might be in the room or on the sides, feel free to move up to the table, and we can fill in, because I know a couple of reporters have had to go on to move onward. But basically, what Laura has been able to do in this paper that we're releasing today is scan the landscape for what may be weak and in need of some major improvement when it comes to teacher preparation for the early grades and pre-K and kindergarten, and also find a couple of hints of promising practices, some places where if we can turn the ship a little bit, we can have both preparation programs and the way state policies are created, we can build a better system, and teachers can be better prepared to teach in these classrooms, including teaching children who are coming with multiple languages to the classroom. So I am going to bring Laura up to the podium, and she's going to give you about a 15-minute presentation of the kind of key points from this paper that we're releasing today. And then we'd like to have your questions as well. We're off by about 15 minutes, so we'll probably just do about 10 minutes of questions, and then we'll move into our third panel before lunch. So, Laura, thank you.
Thank you, Lisa. And good morning to everyone. Thank you for attending our seminar today. Once again, I'm Laura Bornfriend, and I'm here to share some findings from a report we released this morning called Getting in Sync, Revamping Licensing and Preparation for Teachers in Pre-K and the Early Grades. During the presentations this morning, we heard about the need to improve classroom experiences for young children. And this doesn't just mean infants, toddlers, and preschoolers. Kindergartners, first, second, and third graders are still young children as well. And research shows that children in these early grades do not necessarily have teachers who are equipped to teach them well. And the last panel was a good segue for this as well. I've written a report that explains in part why that is and how many improvements will really be required to change it. So potential race to the top for ed schools might be a first step there. Every state requires a teacher to have a license in the grade level they teach. For example, teachers can get an elementary license to teach in elementary schools, and when you're looking at this, you might find the word certification used as well, or teaching certificate. So license and certificate are interchangeable there. What makes this complicated, though, is that in many states, they also offer early childhood licenses, which usually begin at birth or pre-K and extend up through the early grades. So this creates an overlap. And here's an illustration that, or a situation that illustrates why that's a problem. Picture two different prospective teachers living in the same state. One knows that she wants to teach kindergarten or maybe the first grade, so she seeks out a bachelor's degree program in early childhood. Her preparation is steeped in learning about how young children think, how to engage their families, how to identify and help struggling children, and how to employ hands-on and experiential activities with the students in their classroom. Upon completion, she obtains the state's early childhood license, which again enables her to teach, in this case, 3-year-olds through 8-year-olds, students up through the third grade. Consider another prospective teacher. He wants to teach in an elementary school but isn't quite as sure which grade, so he chooses to get a degree in elementary education, which in this state would lead to a kindergarten to 6th grade license. The program he attends puts most of its emphasis on children in the later grades and what they need to be successful. When he graduates, he obtains the state's K-6 license. Now, both of these teachers are ready to seek employment, and they both land jobs in first-grade classrooms. So what's the problem here? Well, at the most basic level, on the one hand, we have a teacher who is prepared to understand how children in the early grades develop and learn. And on the other hand, we have a teacher who was not, or at least not quite as well. But despite their divergent preparation they may have had, they are both licensed to teach in the early grades. So the important point here is that the preparation of early grade teachers must couple the best aspects of traditional elementary and early childhood preparation programs. Young children, for instance, need teachers who are able to engage them in learning and interact with their families and have a strong base of knowledge about subjects like math, science, history, the arts, as well as a keen understanding of the academic and social skills children will need to succeed throughout their entire school career. So, moving on to some problems. Over the past several months, this has been a big topic. We've heard a lot about problems in teacher preparation. And in my scan of preparation programs in 6 states and of state licensing requirements, I found similar ones, but others as well. So I'm going to highlight 5 now, but you can find additional ones in the report and more details on these. First, minimal coursework on what is known as in the field as the developmental sciences. This basically refers to learning about how young children process information and grasp new concepts. Prospective teachers frequently take these courses as a prerequisite to entering the education program, so the concept becomes really disconnected from the other courses they take later on, such as teaching strategies, classroom management, and the content areas, math, how to teach reading, how to teach science. It is really important that teachers have a deep understanding of child development, and here's an example why. For example, a child at age 5 could easily become absorbed with picking up stones they find on a driveway. They explore how they feel in their hands. Whereas a 9-year-old who might be interested in those same stones would be more likely to evaluate, say, the qualities of those stones and compare and contrast them to, the sidewalk or even dirt. I also found minimal admission requirements into education programs. More often than not, people who are interested in becoming teachers simply need a 2.5 GPA, a few prerequisites, and to pass a basic general knowledge test. I also found practical experiences that were basically one-time observations. That's the third one. Sometimes they might be weekly, but these didn't necessarily appear to include direct work with children in a meaningful way, and still in most cases, opportunities for opportunities for real teaching in the classroom to practice that are still just the traditional student teaching experience, which is offered at the end of the senior year, and once again separated from any other coursework that students might have taken. And then also a general more breadth than depth, including courses that focused on strategies that would be appropriate for teaching students in pre-kindergarten through 8th grade or even 12th grade classrooms, quite a wide span there. And additionally, I came across courses that appeared to cover a wide array of topics, which, from my perspective, significantly limits the, amount of depth that teachers would absorb on any one of those given topics. And just a quick example on that, some early childhood programs lump subject areas together, math and science, or science and social studies, for example, or math, science, and social studies, not really, paying a deep attention to any of those on their own. And so the last one I found was out-of-date licensure structures and hiring practices. And I know you can't see this chart very well, and actually that fact illustrates the complexity of this issue. But for a better look at page 10 of the report. So this is a chart of every state and the different licenses that they offer to teach in elementary schools. You can see, there's birth through third grade, kindergarten through fifth grade, pre-K through third grade, first through sixth grade, and lots of others. And one other thing you might note, and that I find interesting, is that only 14 states have a structure in place that requires kindergarten teachers to have specialized early childhood training. Other states have that, what's often referred to as, an omnibus sort of license, kindergarten through fifth grade, or K through, or kindergarten through sixth grade options. Licenses really matter because to some extent they drive hiring practices in the school district, the type of degrees teachers pursue, and the structure of teacher preparation programs. School districts and principals benefit from licensure flexibility, especially when it comes to hiring and layoff decisions. Principals want to be able to move teachers around as needed, and this could mean moving a veteran fifth grade teacher to a first grade classroom. And oftentimes these moves don't take preparation or knowledge about working with young children into account, and there's no guarantee that the teachers moved to the early grade classrooms will be provided professional development that focuses on helping them to work with young children. And again, that's, working with them, knowing how they grasp early concepts. It's not going to be direct instruction, at that level that they might have been more accustomed to in the later grades. And because of overlapping, and then one other point, these practices at the district level sort of influence the type of licenses that teachers obtain. They want to, get the ones that span the most grades, making them, of course, more marketable in the district. And then because of the overlapping licenses, content courses in preparation programs, academic areas, math, science, social studies, the arts, are often the same for both early childhood and elementary preparation, which frequently means that they focus more on strategies to work with children, once again, in the later grades. Certainly, they include strategies and information that early grade teachers need to know, but an emphasis on, grasping those concepts, building that love for learning, building connections between subject areas, classroom management strategies that are specific to young children are not as present. And this, of course, is not to say that early grade teachers do not need a strong foundation in the academic subject areas. They absolutely do. Early grade teachers need the best, once again, of what traditional elementary and traditional early childhood programs have to offer. It's not an either or. And if you look, states like Arkansas, for instance, where there is a distinct separation between early childhood and middle child, Arkansas has a P4 and 4.8 license. They've started to make changes to address these issues that I've just discussed. So moving on to promising practices. Okay, so in the midst of all the problems that we found, I also came across practices that are worth a closer look, like the teacher preparation program at Arizona State University. It's very intentional about embedding classroom experience in coursework. Prospective teachers participate in about 1,400 hours of classroom experience, and can compare this with most states that require about 10 to 14 weeks of student teaching experience, and that equates to about 100 hours. At ASU, prospective teachers also participate in school and district level professional development, parent and teacher conferences, and on-site mentoring. And some of their classes, their coursework is even offered in the school building and taught by teachers in the building. Also found states, in addition to Arkansas, that have made licensing changes. Pennsylvania is an example of a state that's in the process of redesigning its teacher's license to better align with developmental spans instead of grade level structures. The state has a broad elementary license that will be officially eliminated in 2012, and so they're moving to a pre-K through fourth grade and a fourth grade through eighth grade license, so they'll have 1 year of overlap. And then also another practice, and there's more in the report, the National Association of Elementary School Principals has taken a lead in providing resources for principals about early childhood education and, importantly, what high-quality early education should look like. Last year, the NAESP Foundation convened a task force to develop recommendations for policies to better foster better learning environments for pre-K through third grade. And then in the report, you'll find 15 recommendations for preparation programs, states, school districts, and the federal government, and I wanted to highlight 5 of them. Teacher preparation programs should raise the bar on admission requirements in general, ensuring that the elevated requirements also apply to early childhood preparation. States should require approved early childhood preparation programs to provide multiple experiences that are woven into courses and include interaction with individual students and groups. States should separate licenses to avoid overlap in the early grades. School districts and states should eliminate personnel policies and practices that limit principals' options in assigning specific teachers to classrooms. And school districts should provide professional development for principals that includes training on early childhood education and highlighting, ideas like family engagement and how young children learn content. And then as reporters, are thinking about this issue, just some questions you might want to ask or things you might want to look into. Asking education schools about the types of classroom experiences they provide to prospective teachers and how they go about selecting the mentors and supervisors that work with those future teachers. Asking principals and superintendents about the knowledge and skills they believe are most important for teachers in the early grades, and how they go about making sure that those teachers are in place. And then asking principals and districts about district and state policies that potentially hinder their hiring practices. And then also just a couple of more, asking teachers about whether they feel well prepared to teach young children, and then really looking for the evidence that they understand the stages of child development. And then examine whether a state's licensing structure ensures that the teachers in the early grades are prepared to teach those age groups. Okay. And thank you very much. And if you have any questions, we have about 10 minutes or so.
We're going to go now with Title I Report Education Daily. I'm just curious about how the separation of the grades, licensures, because a lot of times we keep talking about the P to 3, and then a lot of these have P to 4. So are you all issuing recommendations about how those grade spans should be separated, or could you just clarify what is the recommendation on that?
Sure. Well, the recommendation that we really went back and forth on this, and our recommendation is that states should look at their structure to avoid overlap, and that's what we think that they can do at a basic level. If you look at the chart, there's some examples. Arkansas, like I said, they've got it P448. Pennsylvania, they're going to have a plan to have one overlap in there, and I think Ohio is P348. So we're not recommending that a specific span is the right one, but just that states need to look at their practices, their current practices, and determine how they could go about reducing the overlap, because the more overlap you have, the more likely that the preparation is not going to be, focused and targeted to the specific age group that those teachers are instructing.
And if I could just add to that, the pre-K third credential is absolutely a really good place to go when you're in a state where there's not also a competing K6 or K8 credential. Because what we found is that in a state that has both, teachers will be more, prospective teachers, those in the education schools, will be more inclined to say, I better go get that K6 degree because that's the only way I can be assured that I'm going to be able to be hired. I'm going to be more marketable. And what happens then, as Laura's laid out here, is that a lot of their training and preparation will be in, say, 4th, 5th, and 6th grade, and they won't have a very good grasp of how to teach kindergartners and how to teach So when we started looking at Pennsylvania and why they made the change they did, it started becoming very clear that that would be a one way to help principals, to help prospective teachers, to help the system in general, put more emphasis on making sure that the teachers of children in those younger grades really get the training that they need to have a really engaging and vibrant experience with those young kids.
Did you come across any specific programs at
just for people who are on a webcast so they can hear you.
Did you come across any strategies to move early childhood teachers in the childcare community into higher education? That's one question. And then the other question, as we talk about ELL populations, the same as those populations grow, the teachers that are ELL, who are primarily working in childcare, how do we move them into the higher education workforce?
Well, we did look at programs at early childhood programs at community colleges and how they articulated and aligned. So how basically those courses were accepted at a higher education institution if the prospective teachers wanted to transfer. And so there's a couple of examples in there. One is a local initiative, and it's in Tulsa, and there's I think it's the University of Oklahoma, or it's in the report. I think it's the University of Oklahoma, excuse me. That they work closely with the community college in Tulsa and to move students that are interested in going into higher education. So the courses, they've looked at the courses, making sure that they align with the programs, and so at a community level, that's a really an intensive partnership there. And then I talked to a lot of community college professors that said that they have a lot of teachers that are interested in moving into higher education, but there's the barriers with getting courses to transfer is a huge barrier, and part of that is there's a little bit there's a stigma with community colleges, maybe that the courses aren't as rigorous, or the experiences aren't as rigorous that the students that are attending them would have, as if they had gone and started as a freshman or sophomore in a university. And so both university professors and community college professors that I talked to are working on, said that there's efforts, small efforts, some better than in other states, to really start talking about what programs should look like so they can more easily transfer those credits. And one example is in Pennsylvania, which I also talk about in the paper. They're doing a statewide articulation effort, and it's not some states have course to course. And let me just back up for just a second. A lot of states have agreements to transfer general education credits. So if you are, you do your AA or your freshman and sophomore general education requirements at a community college, and then those transfer to a university. There's a lot of agreements for those courses to transfer. But to get specialized training, say in early childhood, like you mentioned, those are the courses that are less often to transfer, and it's really up to the professors or the College of Education whether they want to accept them. So what Pennsylvania is in the process of doing is they are doing their articulation based on outcomes and what teachers in the community college early childhood programs, what competencies they gain. So they've identified they have a committee that's identified a list of competencies and that all early childhood professionals should have. And so the community colleges are designing their programs around the competencies that students will get in their program. And then the universities are basically designing what the rest of those 2 years will look like. So it's the idea is that community colleges students will be able to just take their entire program to the university, and it'll transfer as a program. There'll be no, matching up of courses by courses, and I can give you more information on that if you want. And ELL students, I think that, that same would apply to them as well. I didn't delve deeply into that issue.
People who work in community-based childcare organizations and are not native speakers of English, and what are the factors that support their enrollment in higher education and their staying in and completing courses to get, essentially it was mainly an AA degree. And she's identified several factors that are very important to promote higher educational qualifications for this group of prospective teachers who work primarily with English language learners, preschoolers. So, I can give you Marcy's study too. She's done all of it.
Just before I continue, just one other issue, and this we talked just briefly about in the report, that another barrier is the pay parity in a lot of states, with teachers who want to work with under 5, and there's requirements coming down that for pre-K programs they have to have a bachelor's degree, but not everywhere is the pay necessarily matching that, and so that's a big issue that needs to be addressed if we really want teachers in the early years and before kindergarten to advance their qualifications as well, because the cost benefit of having that degree is right now when they go out into the workforce it's not equitable.
One more question. Okay. Hi, thank you. My name is Dana Benzo. I'm from the City University of New York. I'm curious if you looked at the early childhood preparation programs that address the unique aspects of working in the community based organizations, specifically working in teams, the teacher leadership skills, and working with families much more intimately than you do in public schools?
I didn't look at that because my focus was mainly on the early grades, and so I did obviously early childhood preparation. When you look at the degree, some of them span birth through 3rd grade, and some span pre-K through 3rd grade, or up into the early grades. So some of those programs do dive a little bit deeper into community, engaging in the community and working with families, but not all of them. So I didn't look at community-based programs specifically. But thank you.
Thank you very much. So I hope that at least just kind of whetted your appetite. There's a lot in that. There's a lot in that report to digest, and we're happy to take questions on that and be available as kind of develop stories. And again, it's Marcy White book, as you noted, Pilar or Linda, has done a lot of work, wonderful work on community-based pre-K programs, other childcare, preschool, family-based programs, and how to elevate the qualifications of teachers in those programs. So what we wanted to do with this report was take on an area that seemed under-addressed, which was the kindergarten teachers, the 1st grade teachers, the 2nd grade teachers, but see them as part of this pre-K 3rd continuum. See them as very much embedded in how children learn at these young ages. So we're hoping that that our report is a contribution on that front. We're going to switch now and bring up our 3rd and final panel. So if I could ask Libby Doggett and Richard Gonzalez, and I'm blanking out. Actually, yeah, it's Libby Doggett. Actually, yeah, and Pilar, and is Jenny Kenny here? Great. Okay, and I am going to turn over the podium to David Gray, who has been a mentor to me and who is also our Director of Workforce and Family Programs here at New America.
Thanks very much. Thanks, Lisa, and thanks for everyone for being here today. As you know, this panel focuses on the critical connections between parents and our programs and health. We're all concerned about the systems that support families with children, but an effective system of support for families and children from birth through age 8 must include many different players and make connections between those players, the programs, and each other. And there's an urgent need to make progress in this area, as we know. 1 out of every 5 children in our country lives in poverty. We have one of the worst rates of child poverty among developed countries. Working families are struggling. Median incomes are stagnating. Real wages for families have fallen since 1973, and many parents are working 2 jobs to make ends meet. It's a struggle to find time for parental involvement and family unity, for learning, and even for healthy family habits. Most families don't eat together more than 3 meals 3 nights a week, and that impacts food choices and the health of children. And parents bring home their work-life stress from the office, and that impacts their little ones. It's one reason I feel that workplace flexibility policies are so important to helping parents and the health of working families. And so on this panel today, with your help, we'll be spotlighting 2 areas: parental engagement and support and health. And fortunately, as Lisa mentioned, we have a strong panel of folks to help us do that today. Richard Gonzalez from the U.S. Department of Health and Human Services, Libby Doggett from the Pew Center on the States, Pilar Torres from Centra Familia, and Jenny Kenny from the Urban Institute. Thank you for you all for being here today. Let me start with the first question. Given what seems obvious, that public programs for kids should be coordinated and should include parents and health, I'd like your thoughts on why isn't this happening? What is standing in the way of such coordination? Would anyone like to kick it off with an answer? Rich, should we just start on my right here and we'll go down the line?
That's fine.
Please, very good.
Okay. Well, I think we would all agree that we need to do a better job coordinating across all service categories for children and families. And rather than talking about what we're not doing, I'd like to talk about what we are doing. In the Office of the Deputy Assistant Secretary for Early Childhood Development, within the Administration for Children and Families. You may or may not know this office, but it is responsible for for Head Start, child care, and the newly funded home visiting efforts, program services areas. But what we've done is we've looked even further at creating the foundation that supports those services. So we have basically the idea that health and family engagement really runs common across all of the service delivery models. And this is kind of a framework by which we want to support the programs. We have certain strategies within ACF that focuses on, of course, for the service delivery, program management and accountability. We have to make sure that it is of the highest quality, and we have to promote the quality coordination of those services that we're talking about here. So what we've done is we've looked at early childhood system reform around such things as how programs are governed, early childhood standards, the guidelines. We've heard some talk earlier about professional development and what's needed for teacher engagement as well as family engagement, and then the health linkages that need to be made. We focus on the health linkages in such a way that I'm not sure how many of you are aware, for example, that the Office of Head Start has recently funded national centers on linguistic and cultural responsiveness, on teaching and learning, on family engagement, and on program management and fiscal operations. And there's one that's going to be funded soon, a national center on health, oral health, mental health, and nutrition. So this focus coming from ACF and within the Office of Head Start that would benefit the entire early childhood field to focus both on the family engagement piece and the importance of health with families. The other thing I just want to mention quickly is that we have therefore looked at ways we could do better linkages with the Department of Education, ACF and the Department of Education. So we've created an interagency policy board that looks on common elements across the 2 agencies where we can come up with joint statements. There will be a joint statement coming out not in the not too distant future on family engagement, the importance of family engagement and how we support parents regardless of where they are in the continuum from birth through age 8 and on after that. In addition, we have looked at creating within the health linkages, more linkages with other agencies, federal agencies, so Department of Agriculture, SAMHSA, Maternal and Child Health, looking for ways across federal agencies that we can do better linkages to support health services, regardless of who the families and parents are that are being served. In addition, then, we've also looked at launching innovative projects, and one of those innovative projects have to do with state advisory councils. I'm not sure how much you've heard about this, but money was made available so that states could apply for these federal funds that would allow these state advisory councils or early learning advisory councils to be able to look at ways they could improve or enhance the coordination and collaboration of early childhood development services within their states. So how do they find ways to take care of coordination and collaboration across all of the early childhood programs? And that again includes a foundation of looking at health linkages and family engagement linkages. What are we doing? How do we do it more effectively? Whether that be data integration, sharing of data across services, ways we approach teachers, so they're going to, these councils are going to be looking at assessing the capacity and effectiveness of institutes of higher learning as it relates to the development of early childhood workforce. They look at such things as the statewide professional development career planning for those teachers, as well as the improvement of early learning standards and a needs assessment. So, and then finally, there's one other piece that we're encouraging, and this is the concept of early learning communities, where we look at communities within states that are focused on safe and healthy and happy children, birth through 8, and we look at those communities within states that have found ways to integrate and coordinate their services effectively, so that parents are playing a key role, health is playing a key role, and they collect data at birth, at preschool, at grade 3, so that we can look at governance issues, quality assurance issues, data integration, and the connection with the schools. And I could go on, but I'll stop because we've got 3 other people who are going to have to talk here. So thank you.
Great, thank you. Thanks to the New America Foundation for doing this, and thanks to you all for coming and spending this time on this important issue. I do want to answer the question of how there can be better coordination between parents and health and education, because I think all 3 need to be coordinated. But before, I want to give a little bit of context, just as Richard did, about my role. I'm at the Pew Center on the States, and at Pew, particularly at the Pew Center on the States, we try to work with states to build high-performing states that deliver better results and help states have better budget health through budget discipline, and spend money on programs that get the highest return. And so today my role is really to talk about our home visiting campaign. We're working in a number of states, not as the federal government, not as the state government, but really as an outside agent helping states, because that's our role, build strong home visiting programs. And my husband said, well, Libby, no one knows what home visiting is, so I'll tell you a little bit about what we think it is. One is it's voluntary. So home visiting matches parents with trained professionals who provide information and support during pregnancy. You get in there early, and throughout their child's first 3 years. And I know you've heard today about what a critical developmental period that is. And there is great research to show that this support helps families thrive, but it also saves states and the federal government on costly later problems. Example, premature birth rates are lessened. Infant mortality rates are less. Costs associated with child abuse and neglect, and welfare dependence. So we have some good research about the results of these home visiting programs. We're fortunate that the federal government realized this, and we now have $1.5 billion over the next 5 years. So this is going to be a good story, because states are pulling down this money, are starting to plan these systems. But now to your question. I think there are a number of reasons that we haven't brought these 3 systems, education, health, and parents, together. And home visiting is one that's really attempting to do that, because we're delivering all of those kinds of things in one place. But I'll throw out attitudes. I think that if you look at polling over the years, that our country has more ambivalent attitudes toward services as children get younger, even though we need them more. and we know how vulnerable babies are, there's still a reluctance on the part of our citizenry, particularly our elected officials. Then I think politics sometimes gets in the way. And then lastly, let's face it, we're in a difficult fiscal position right now. And when times are better, I think children and families do a little better. And when times get tough, I think children's services get cut. And we're seeing that across the country. So I'd say, attitudes, politics, and fiscal reality get in the way.
Great, thank you.
Well, I think one of the biggest obstacles for the population that I work with, which are immigrant families and the children of immigrant families who are not immigrant, they're American citizens, is that the immigration policies of this country are making it extremely difficult for families to really enter into our society. So we are in a situation right now where Pew is predicting that by 2025, 1 out of every 3 children in this country are going to be Latino. 52% of the children who are described as Hispanic Latino in this country are children of immigrant families. And many of these immigrant families are in a perpetual state of limbo, where they're very shy of the system, the system. They're very reluctant to participate in certain programs, and we have children who are participating in early childhood programs at a much lower rate than for other ethnic groups. We have parents. The whole issue of parent engagement in this community is very challenging and very difficult for many reasons. Language barriers. We have poverty issues, but we also have this lingering immigration problem. So I think that, as we try to, I feel very strongly that the issue of Latino children's achievement and improvement in their education outcomes is really it's not a Latino issue. We can't treat it as a Latino issue anymore. This is a national well-being issue. This is the future workforce of this country. This is the future, period. This is the new America, and we talk and talk and talk, and we go around, and we describe strategies that work. One of the things I like to say when I am invited to speak at some of these events is that we hear a lot about the policy perspective, the research perspective, the practitioner's perspective, but what about the barrio perspective? Like, what does it look like when you're actually in those neighborhoods and you're a mom with 3 kids, all under 5, and you're trying to survive? You can't work. You're not legally allowed to work. It's incredibly complex and incredibly difficult. I have a couple of stories in terms of, one of the problems, one of the issues that I have in terms of how we assess children and why it's difficult for families to become engaged sometimes is that from the beginning of the child's education, so let's say they're in a preschool, that they're lucky enough to be in a preschool, one of the first encounters that a parent might have is that they're being told that their child has no language proficiency. Because in many instances what we are calling language test is English language proficiency. It's not language proficiency. And I experienced many situations as a provider, working in the community, where my own teachers were really struggling with this idea of how do we measure these kids' language? We know we were giving them tests, visual tests, where they had to identify particular items, and that child would identify it. He knew it in Spanish, but he didn't know it in English, and he was marked not proficient. And then you go back into the family and you give that feedback to the mom, your child is not proficient in language. So you're setting up a whole dynamic immediately where you're basically telling the family you're not functional. Your child has a deficit because they speak another language. When in the rest of the world it is an asset to be bilingual, for our children, our Latino poor children, it is considered a handicap. So those things need to start to change. Dual language, Linda was talking about dual language education. My children are a product of a Spanish immersion program in Montgomery County. The people that were on the waiting list for those programs were middle-class families who were desperate to get their children to learn a second language. Why are we taking the second language away from the Latino children when we could be building from this asset that they have, but that is never presented as an asset to the family? So I think these are some of the overall challenges that I'm concerned with from the view of the barrio, from the view of the parent.
Jen?
Well, I wanted to zero in on a narrower question, I think, as a way of illuminating what I see are some of the major disconnects. And the question that I posed is, why is there an under-provision of key health and developmental services for children in early childhood? Of course, there are a number of contributing factors, but I want to highlight the following. First, I think the fact that we don't really take a life cycle perspective on childhood and link services and experiences that kids receive at one point in childhood to their subsequent experiences and outcomes is just a fundamental barrier. Second, the lack of integration between the health and education sectors likely leads to an underinvestment in health services in early childhood. And third, fragmentation within the health system, in the health sector, also leads to underinvestments in services that have longer-term payoff or that may, say, have payoff for the child, but require services to the parent. Well, as everyone here knows, many young children, including those who are covered by Medicaid and CHIP in our major public health insurance programs, have health, behavioral, developmental problems that are not detected before they enter kindergarten. And those problems often adversely affect their school performance and lead to costly special education expenditures. But the root causes are not lack of eligibility for coverage. Most young children are eligible for coverage. And it's not, if they're enrolled in Medicaid or CHIP, a benefit or cost-sharing set of issues. The Medicaid benefit package is comprehensive and includes well-child visits, screenings, and any follow-up services that are needed to address problems that are identified with screenings. And no cost-sharing is attached to those services in Medicaid. So those aren't the root causes. In the Medicaid sector, the under-provision of developmental screenings is related to discontinuities in health insurance coverage that lead kids to be in and out of coverage, in and out of different managed care plans, and discontinuities in their providers that they see, so that as a consequence, many kids don't have a regular provider who's tracking their care over time. There are also gaps in terms of provider training, reimbursement shortfalls. There can be real issues making referrals for children who do have problems that are identified in the developmental or behavioral arenas. And fundamentally, and this has kind of been a theme here, the restricted access to services that many of their parents has is an issue. Currently, we have no systematic way of tracking the extent to which the developmental needs of children are being addressed in early childhood and what consequence that has for the child once he or she enters schools. We really don't have ongoing monitoring that allows us to make that connection. It's a function of our data systems, which don't collect and report on receipt of developmental screens or on follow-up care in any consistent way, which don't track individual children over time, and don't assess the health services they're receiving or not receiving in the early years with their school performance and special education spending once they enter school. So why isn't there pressure from the education sector on Medicaid? to increase the extent to which kids in early childhood, many of whom are covered by Medicaid, are receiving screenings and follow-up services. I mean, it's so obvious. The budgets aren't mingled together, and the agencies aren't housed together. And in fact, they're often pitted against one another. I think that's what we're seeing in many states right now with the current budget crisis, as states are facing very tough choices and they're trading off education spending with health spending. So even if targeted spending on particular health services in early childhood could reduce education spending down the road, there's no incentive right now to make that happen because there's no benefit that'll come back to the Medicaid program. Right now, the Medicaid program official just has to account for the fact that spending went up, not that there was some savings elsewhere. I also want to emphasize the fact that so many kids who are covered by public programs have uninsured parents who face many more barriers accessing care. As many of you know, many young mothers in low-income families suffer from untreated depression, which in turn affects the health and well-being of the child. And yet, it's very limited access to services to address that, even though it's leading to under-provision of developmental screens and causing problems for children. Some states are innovating in terms of trying to screen the mothers of infants for depression and billing through the Children's ID, and this can deal with some of the immigration problems that prevent parents from having access to these services. So I just wanted to close with the need, I think, to step back and for the approach that we take to early childhood to be comprehensive, holistic view of the child that takes a forward-looking view that links across sectors, links across the child's life cycle, and that really takes a family perspective. Children aren't the decision makers, certainly not in early childhood, about what services they'll seek and where they'll go for care. And I want to pick up on something that Richard said. I think it is a really exciting time. And there are many opportunities that are presented right now by the attempt to collaborate across agencies at the federal level and in many states. Also, there are many new investments in data right now related to electronic health records, and there are opportunities associated with health reform. Home visiting is one example of a new important investment, but the coverage that will be provided to parents could have major positive spillover effects on children. But I would say the promise of these investments and of this potential is not going to be realized until we internalize the benefits of investments in early childhood on the health side in terms of the longer-term gains for children.
Thank you, Jenny. Thank you all. And we'll open up to your questions. As we do, I just have to reflect on some of our discussion on the integration between the personal and the policy, just from my own context. In the 90s, when I was working with Libby, I was with Senator Voinovich on some of these issues. I ended up marrying a colleague of Libby's who was also working on early childhood issues, and last month we had our third and fourth children who are in this target age group that we're talking about today. And this morning, Bridget's taking our oldest to look at kindergarten for next year. And we, who are two working on these issues and supposedly know a little bit about it, are just struggling to figure out all the different programs and options within this area. And so I think about trying to apply that more broadly, the importance of coordination and the challenging of making sense of it all. Anyway, enough about me. Let's hear from you. Opportunity to converse with our four panelists and participate with any questions that you might have.
Thank you so much. This is very interesting. I'm from reportingonhealth.org, so this is a big topic for us. I was wondering, though, I mean, I know that the name of this event is Birth Through 8, The Hidden Stories. And I'm trying to get at the idea that we don't have the right mindset around early childhood is really interesting to me. And we don't have the right mindset around access for Latino immigrants as well. But it's a hard story to get at in a lot of ways because it's a long-term story. What kind of advice would you offer to journalists who want to actually tell a story, not just the policy angle of it. Do you have any kind of nuggets of wisdom about where to start and how to kind of track things as they progress?
I think one of the things we really need to start to talk about is that what will this country look like in 25 years, and project back and see what could we have done now that we didn't do. And I think that the issue of access and making systems seamless and coordinated in if you qualify for WIC, you don't qualify for Head Start. If you qualify for Head Start, you don't qualify for necessarily for vouchers. If you qualify for voucher, I mean, it's we would train our staff by forcing them to take a bus and go to each one of these things and find out what it's like to be a parent. So I think that, one of the issues, I think we do need to sort of start telling the personal stories behind all of this. And, I think one of the most important things and every time I say it, people are shocked. The majority of immigrants in this country are Latino, but the majority of Latinos are not immigrant. This story doesn't seem to be out there yet. We cannot continue making everything related to Latinos in a story of immigration. This is not a story of immigration anymore. It's a story of American citizens. And these children are American citizens. And what are we going to do so that they can grow healthier and stronger and become capable of working in the biotech industries that are going to take us into the next, half of the century. So if we don't, we are in a lot of trouble as a country. This has nothing to do with liking immigrants or not. And this is, a lot of us, there are a few Latinas right now that are in sort of interesting positions, and we sit around and talk about this. How do we get that message across, and how can the media play a role in that?
Well, I think the power of the story, and you all have the power, is immense. And we have two good examples. In a few years ago, there was an article called "The Swamp Nurse" in the New Yorker about home visiting. And because of that, we now have a federal law. Who knows if it's directly correlated, but you had to see, we saw a great interest in home visiting as an intervention for families, Latino families, other poor families, after that came out, and it was a powerful story. I'm reminded also in the health area about the story of Diamante Driver, who was a child who had dental problems and died in Maryland. And Maryland now has some of the best dental health services for young children. So you really do have some power if you can find those personal stories. So, call up people like Bilal at different agencies and ask them if they have stories. Call up your new, some of the home visiting programs, because we know they're calling us with stories all the time about these families. And we have one on our website that you can go look at where, a young mother, these are often teen mothers, they have a home visitor come in. They are asked about their goals in life. They've never been asked about their goals in life. They all of a sudden, realize they might go back to school. They might get their GED. They go on to the community college, on to college. They do something with their lives. They turn their lives around, and there are amazing stories there, even in a couple of years. So there's some great stories there for you. I think it's also interesting in early childhood, and I hope some other of the speakers talked about this, about the new players. I've been an advocate all my life, so my story, my interest in this is not that interesting. But the business leaders that have gotten involved in early childhood, that's a story. Mm-hmm. Why is it that the business community is so interested in early childhood now? It's because they see that unless we do a better job with our young kids, we're not going to have the workforce we need. People involved in our safety system, our police chiefs, our DAs, they're all very concerned. We have a group called Fight Crime, Invest in Kids that came together specifically because they saw that the best way to fight crime is to invest in young children. So there are new actors out there, and you should look at some of these and ask them, why in the world are you interested in early childhood? And then, we'd really be interested in the story because there's lots of cutting going on right now. Who is doing it with the scaffold? Who is looking at what the evidence is? How much is the research? We spend billions of dollars in this country on research, and we know a lot about how children thrive and what works in education. You've just heard a lot of it. The people that are making the decisions right now, how much do they know about this research? Is there a connection between research and policy and the cuts that are being made? Are we making across-the-board cuts? Because if so, we're not really looking at what the data says. Because if we're looking at the data, we're not cutting most of the programs that serve young children.
Oh,
Jenny,
I just wanted to say, and Richard may be able to speak a little bit more to the early learning communities, but I was going to bring up the early development instrument. I think there's some communities that you could identify that are doing really innovative, making innovative investments in data collection and linking those to policy. And this early development instrument was developed in Canada, but it's been adopted for use in several local communities in our country, and basically collects information on school readiness when kids enter kindergarten, and then tracks back to look at what the deficits and gaps might have been in early childhood, and that's used as a motivation not for intervention at the individual level, but more at the community assessment in terms of problems and possible policy solutions.
And I did want to speak on the early learning communities a moment, because I think very soon there'll be a compendium coming out that'll be released they'll highlight some communities that we've learned about around the country. And these communities, what they've done is they've really focused in a concentrated way in looking at the children and families in their community from pregnancy through the third grade. And they've started by looking at birth data. They've started by tracking children's health issues. They're working with parents to understand the information as it becomes available. They're making decisions so that when they come together to coordinate decisions, there's the health people, the education folks, the business world, everybody is coming together to try to strategize on how to make differences that are going to be meaningful and longer lasting. And what we've encouraged within those states to do is to begin to look, although we're going to highlight 9 or 10 different communities, there are more that are out there. And we're asking states to begin looking for these communities and how they're beginning to come together. And while this is not a funded effort, the Office of the Deputy Assistant Secretary for Early Childhood Development is really focused on trying to identify such communities, link them together, have them talking with one another, giving them opportunities to highlight what they do in other conferences and events so that they could speak about the information and the sharing. And I think this is going to be a model that's going to expand and really begin to make meaningful differences in communities. And it could become then a model that just could begin to grow across other states. The other thing I wanted to mention within the office is an initiative that we're supporting. Within ACF, there's a group called the Office of Community Services. And one of the things they coordinate is something called the Asset Initiative. And this is about basically asset building strategies. How do you begin to look at ways to help various people look at what their assets are and how it can support their development? We know the evidence shows that financial stability within families has a direct impact on early childhood development and development of families. And we know that even in our own families, that our own financial well-being or lack of well-being affects how we think and what we do with children. And so what ACF has done and what the Office of Deputy Assistant Secretary has done is begun a project called Financial Stability for Families with Young Children. And we've begun working at the regional level so that we could begin to bring early childhood people and asset building strategy folks together to talk about how do we help educate families, especially our poorest families, on what this means. Now, the first thing I want to point out is that when we started talking about this, people immediately began to think, well, asset building strategies, that has nothing to do with poor people. because we think of asset building as getting a home and starting a business and maybe going to get a college degree, and many of our poor families are not there yet. So we shouldn't be talking to them about asset building. Well, that is wrong, 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 because asset building is starting with whatever you have, wherever you are, those $10 in your pocket and how you use that $10. Whether the strategies we talk about are the value of using banks, or what do you do, how check cashing places, for example, there's a cost there. If you deposit your money in a bank, that $2.50, that $10.90, whatever it is, can be used for something else. Looking at predatory lending and the impact it has on parents, good credit, bad credit, how you handle credit, how you handle debt. So the whole concept of financial education and starting that education with the child and parent learning together, and just what do you do with money? We know that our attitude toward money, our expectations toward money often drive how we handle money. And we could all tell stories going back to our childhood of things, the ways our parents talked to us about money. One just personal story that I didn't fully understand. A while back, I lost my job unexpectedly. Before this job, I lost my job unexpectedly, and I came home and told my wife and my daughter. Now, my daughter at the time was 16, and I told my daughter that I lost my job. We're going to have to start looking for work. This was about 2 years ago, or a year and a half ago, and I was shocked to hear, my daughter said to me, "You're kidding, right?" And I said, No, I'm not kidding. I lost my job. I'm going to have to look for work. And she looked at me, and this kind of fear came over her, and it was kind of like she started crying. And I couldn't figure it out. I was like, she's 16, why is she crying? I mean, people lose their jobs. What's this about? And literally bawling, and I tried to think about it, and I immediately tried to say, okay, what is going on here? And so I said, okay, first of all, Alex, Alex had the benefit of going to a private school, a high school. Alex, you're not going to have to stop going to your school. You'll be able to get your degree, finish school. We'll figure that out. Alex, we're not going to lose our house. We're not there yet. We have some savings. We'll be okay. And tried to come up with the things that I thought would be the points that was upsetting her. And the reason I'm sharing this with you is I started to think about it. My wife reminded me that as she was growing up, Alex was always worried that we would lose things, like we'd lose the house, or we'd lose the job, or we would lose things. And this attitude that she had, not quite sure where it came from, but this fear that she had kind of continued with her and affected the way she was responding. And I think about this is a 16-year-old. What happens in a household where families are losing their jobs, losing their homes, having trouble making ends meet? Our poorest families who are always trying, or even our homeless families, what they're trying to figure out and what to do, and they have young children. What are the messages the young children are hearing? How are we doing this? So again, looking at this financial stability project and what we can do, how we begin to help parents and all of us understand financial education and the practices we can have, I think could have a really meaningful impact on mental health of all of us, especially in these economic times. And so I share that with you.
Very rich responses across the board. Let's hear any more questions here. Yes, the gentleman here.
Hi, I'm Jeff Capizano from the Policy Equity Group, and Richard's former colleague from the Department of Health and Human Services. It seems when you talk about sort of the integration of services for children sort of on the ground, one of the reasons why it's so difficult is that there are structural barriers that derive from the pieces of legislation that authorize the program. So you've got Head Start, federal to local. Cornelia talked about this morning. The Child Care and Development Block Grant, that's federal to state. And the reason why the Early Learning Communities Initiative is so important is that communities, have to figure out how to put the pieces back together that the federal government and Congress have sort of ripped apart unnaturally. And so one of the things that, I'm thinking that might be helpful is some sort of strategy or initiative that talks about joint reauthorization proposals of these initiatives in Congress, not just looking at ESEA, but looking at it in relation to the Child Care and Development Block Grant, Head Start. I know a lot of these programs are going to be reauthorized over the next few years, so just wanted you guys to react a little bit to that.
Mm-hmm. Good question. Any takers? I see Libby reaching.
Boy, Jeff, you got the easy one. Well, I think it's a wonderful idea. I think in practicality, I don't think we're there yet. And so we continue to piecemeal things. I mean, one of the problems is the system's so underfunded. It really is underfunded when you look at what people in child care make. You probably look at our home visitors and home visiting. They're not as well compensated. I know you heard earlier that early childhood teachers often don't make what a kindergarten or first grade teacher might make, even though we consider that an early childhood year. So the system is underfunded, and I think when there's lack of funding, it's very, very difficult to do the kind of innovations that you're talking about, and that's why we're all so excited about these early learning advisory committees. We're so excited about the home visiting because it is in and of itself another opportunity to try to look at what's going on for young kids, provide some federal funding, and help communities and states start bringing these together. And we know that there's some programs out there that aren't as good as they need to be. We need to bring them up and make sure that they're getting the same kinds of outcomes in terms of reduction in child abuse and neglect, preterm births, and other things like that. So, I'd love to say, yeah, this is going to happen, but realistically, I think it's going to take a while, and that we're going to have to really use the opportunities that we have with the Early Learning Council, the home visiting, to make some major changes over the next few years.
And I guess what I wanted to comment on is I kind of agree. I think we're a distance away from being able to do the joint reauthorization proposals, although it's something we should be focusing on, talking about, thinking about. On the other hand, I think that we continue to look for ways to look at some of that discrepancy between way programs operate. So, for example, again, within the Office of the Deputy Assistant Secretary, we've started some innovative pieces, or projects, pilots, if you would. We have something called Learning Lab that's going to focus on, right now, the way Head Start monitors programs, or if you're an agency that has Head Start, child care, pre-K, you actually get funded 3 different times, and some of the rules are a little bit different, and that portion of your program gets funded. We're bringing together folks in a couple of states to talk to us about this and to look at, can we look at the common elements that are for monitoring, for example, of programs? Can we come to some agreement that how we monitor a program, that these elements could be the same, so that if a program gets monitored, it would be monitored at the same time across all programs. Same type of thing with school readiness goals, or different school readiness goals depending on what state you're talking about and what you're doing. How do we begin to look at where programs get to develop their own school readiness goals? How do we begin to look at school readiness goals and come up with common ideas? Likewise, I think we're looking, for example, we have a pilot on early Head Start and family child care. Mm-hmm. And what we're looking at is, what have we learned from the early Head Start model and services that can then be partnered with family child care providers who often don't have other supports for themselves. If we bring a group of family child care providers and they link with early Head Start programs to learn some of the practices and get some of those additional supports, there may be ways to build stronger networks of family child care providers that are supported. And another pilot we have, it has to do with teacher mentoring. So how do we look at the value? Research tells us that mentoring is very important and makes a difference for teachers. How do we look at this? So we have 122 grantees around the country. This is a Head Start specific right now, but as we look at the lessons we can learn of the value of different ways of teacher mentoring and coaching, we can then pass that information on to the broader early childhood field. So I think that we're trying to find ways to look at duplication. How do we remove duplication? How do we come up with policies that are going to be consistent across more than one funding stream? And maybe if we begin that way, maybe that'll move us backward into the way of coming up with a joint reauthorization process somewhere down the line.
Can I add one more thing? Unless someone else.
Yeah.
Well, I want to introduce Nicole Barcliff back there. Nicole is actually working with us at Pew to insert some of the same language from home visiting into other federal programs. So that's a start toward what you want. And then I also wanted to mention Pew has a very new project called Results First. And we are working with states on looking at evidence and research and what that tells us in terms of making some policy decisions. It's quite exciting. We're rolling this out first in Idaho and Connecticut around corrections because there's really good research around that, but we're hoping very soon to move to some of the early childhood interventions which have wonderful research base behind them.
Thanks, Libby. Other questions here?
I want to say one quick thing about the role of the media. I'm always very disappointed that at these events I never see ethnic media. And when are our own media outlets going to understand the role that they're playing? You guys are gathering information and you're writing stories about what's happening in early childhood. I think the Latino media plays an enormous role in engaging families in the outcomes for their children. That is the only point of contact with the outside world is the television and radio for many of these families. So I feel like they play a huge role. I don't know if there's actually anybody here in the room, but I always feel sad that there's no one ever here.
Thank you, Pilar. I'll ask one question here before we start thinking about moving on to our next piece. And I know we stand between lunch and Jerry and other good things, but just in terms of a little bit more thought on coordination of programs and what we know about programs that are coordinating to help support parents, or even program evaluation. Do we have some sense that some of the programs that are coordinating work, and what do we know about coordination that might be going on, or even evidence that some of the programs that either focus on coordinating or are the programs themselves are working better than others? I just want some reaction to how the field is thinking about evaluation of programs and the underlying programs, and then evaluation of the coordination. More thoughts on best practices or investments in coordination that we should be making as a country, an evaluation of coordination that we should be making as a country.
I can talk a little bit about access, which sometimes is the first step. I know that Pennsylvania has done some very innovative things as the entire state sort of stopped and took a look at how they can change policies and all the make the application process to all of these programs a little bit more seamless and electronic, and that make more sense to families, and giving community-based organizations a computer where the parent can apply online at that agency, not have to go take 15 buses. So I think there's some really interesting things in terms of facilitating applying and access to these programs that are very important. I mean, I think one of the biggest problems for Latino families is that they don't even apply.
Thank you, Pilar. Jenny?
Within Medicaid, I would suggest looking at the literature that focuses on the extent to which case management and care coordination services are connecting families to the broader base of services they need, or children to the follow-up services they need. And I want to draw your attention to a series of briefs on the Urban Institute website, funded by the Birth to Five Alliance, jointly done with BUILD and NASHB and Urban Institute researchers, that looks at developmental screenings, receipt of referrals, but also has a brief by colleagues at NASHB that look at care coordination and point to several really pioneering examples in different states that have tried to address the barriers that are keeping families from getting the full complement of services that, just even from the parochial perspective of health, are impairing the health and well-being of the children.
Thank you, Jenny. Any final comments? Libby,
well, my final comment was ask Jerry Wiest because he's done it, and I think he's just done a terrific job of really taking a school system, looking at the early childhood pieces out there, and doing the coordination. And I'm sure that he will tell you about the results, but the results are, kids doing better. The third grade scores are up, the more kids graduating, and so the results that we like to see are there. So I think that's really a great story. We were pleased to be able to tell that. We have a brief on the Pew Center on the State's website under our Pre-K Now. And I think, it'll be interesting to watch home visiting, because I think it will bring many of these pieces together for families, because as Pilar has made such a good point of, families don't know where to go, and when they have somebody to kind of shepherd them through the process, they end up using the services, becoming self-sufficient, which is what we want, and then contributing back. Thank you.
It's a good introduction for our luncheon speaker, but we'll give the last word to Richard.
Thank you. I would be remiss if I didn't at least mention the Office of or Head Start Services, and when it comes to parent involvement and family engagement. Many of you probably know this already, but clearly one of the successes, one of the unique features of the Head Start is that it's work with the parents and to help the parents understand and to value their role as the first teacher of the child, but also to build their own self-sufficiency skills and to find ways to transition into the school system, etc. We just had a recent meeting where we were focusing on data, the use of data to improve outcomes, program outcomes, child outcomes, etc. And what we began looking at family engagement issues around this. And one of the things that I thought was intriguing was a couple of programs we were talking about how you share data about how a child is progressing in the classroom. And a couple of programs have begun to look at making computers available to parents so that parents could actually access and put in data about how their child is doing at home. It becomes part of the child's record of of the progress that the child is making. So kind of that ongoing assessment piece. And so we're beginning now to look at ways that computers and the use of computers in our at least in our Head Start programs, can be used to incorporate parents even more to look at having some say in the way they assess their children along with the teachers. And I know we're out of time, so I'll stop.
Thanks, Richard. Great, very good. Will you join me in thanking our panelists? And what do you do?